Hello everyone, my name is Ruth Mutale. I'm an online student at Brigham Young University doing health studies. I'll be doing my online cholera workshop presentation which will clearly explain what is cholera and the ways to reduce the spread. Thank you. Okay, so on this screen we see these women getting water from a safe source, which is tap water. So obtaining water from a safe source eliminates the spread of cholera, and water plays an important role in our body and it keeps us hydrated. So cholera is an acute diarrheal disease. It normally affects the third world countries. Normally what really causes cholera to affect the third world countries is due to the absence of proper sanitation systems, and cholera is no longer the dreaded disease of the past because it can be prevented with the oral rehydration salt solution. Okay, so this is the vibrio cholerae which I was talking about. The vibrio cholerae is the cause agent of cholera. It is responsible for cholera. It is a bean-shaped bacterium with a long tail that it uses for self-propulsion. The bacteria are transmitted between humans through the fecal oral route. So, cholera can affect any age. It affects children, it affects the middle age, it also affects the elderly. And it causes severe morbidity and mortality. When I talk about morbidity, it means that it is the state of being unhealthy of a person, and mortality, it means that it is the state of being subject to death. And also cholera affects both sexes, meaning it affects males and it also affects females. There are also environmental factors of cholera, and water is the most important source of infection, and food also may be a source of infection, so we really have to watch the food that we're eating, if it's safe from this bacteria, from the vibrio bacteria. And we should also eat hot meals which are also normally free from germs, and we should also drink water from a safe source, from boreholes, safe source boreholes, and tap water. And cholera is also contacted from contaminated fingers, meaning that we should also wash our hands before eating and after using the toilet, or even to just walk around with your sanitizer so that your hands will be free from these germs. And the incubation period for cholera is 1 to 5 days. And when I talk about incubation period, it refers to the interval between the time of infection and the first appearance of the symptoms of the disease. Okay, so this is a picture of two males, a minor and an elderly person affected by cholera. Badly affected by cholera. Okay, so We can control cholera from health education and improvement in sanitation, and also we should avoid close contact with cholera patients. And the secondary prevention of cholera is early diagnosis and treatment. Treatment like the rehydration oral with the radiation salt solution, and the use of antibiotics, and also isolating the patient to prevent the spread of the disease, and disinfecting all infected material to prevent the spread of this disease.